Now, much of Europe too is seeing a drop in new COVID cases, but health experts are worried regardless, and that is because, as we know, those more contagious variants of the virus are gaining ground. A World Health Organization official says the variant first discovered in the UK has already made it to more than half of the countries in Europe. There is concern that current lockdown measures won't be enough to keep it under control if it becomes dominant. New COVID strains have Germany on edge. It's one of the main reasons the German Chancellor Angela Merkel is extending the country's lockdown until at least March the 7th.
The English variant is the most widespread here. Experts tell us that it's only a matter of time until these variants become dominant and oust the original virus. We have to prepare for that.
Ravina Kular is an infectious disease expert and epidemiologist. She joins us now live from Los Angeles. Good to see you, Doctor. Numbers dropping, that's obviously great news, but the reality check is the overall situation is still bad. The virus spreading rapidly in the US, those variants. More than 2,500 Americans are still dying every day, and then you've got those contagious variants. How do you view the landscape given all of that?
Great to see you, Michael. The great news is, as you stated, that cases are dropping. Hospitalizations have decreased as well, but we're averaging 2,500 deaths per day here in the United States. And my concern is these emerging variants where we have the B117 UK variant, which is 70% more transmissible. And recent data just show that this variant also leads to 35% increased risk of death as well. The two variants, which I'm also concerned about, are the South African and the Brazilian variants, because they have the potential to outwit our immune system. So what it's been shown is that our antibodies, which are developed after one develops an infection and after one gets vaccinated, that the antibodies are not able to neutralize the virus, which is very concerning.
Yeah, in the UK, the scientists there were saying that the variant could sweep the country and is going to sweep the world in all probability. And then a member of the UK Scientific Advisory Group has said the Bristol variant might, quote, infect people who were previously infected or have been vaccinated. Now, how concerning is that in the context of vaccine protection?
That's extremely concerning. I mean, looking at the Bristol variant is a variant of the UK B117 variant. So these variants that have been circulating around are mutating themselves. And the fact that they're able to reinfect those individuals that have already gotten an infection means that these viruses, they've outsmarted our immune system, and they're able to bypass our antibodies or immune system, and they're able to bypass the effective vaccines. We've already seen that the Moderna and the Pfizer vaccine have a decreased efficacy with the South African, with the Brazilian variant, and also the Bristol variant as well, which is very similar to the South African variant. And the two new vaccines, which are in the pipeline, have shown the same effect as well, the decreased efficacy.
Right, and you know, it's interesting. What we're learning about variants shows the importance of genomic sequencing, where the scientists will look at it and they'll see where the variants are. And the US still lacks the world in sequencing, and that means the US doesn't actually know how widespread the variants are. Is that right?
That's correct, Michael. I mean, the U.S. lags drastically behind the UK, which is top-notch in terms of sequencing their strains, and we lag. We're one of the worst countries in being able to sequence these strains, and we really just don't know how many of these variants are circulating around. So the numbers which are projected to us by the CDC is likely an underestimate.
And I guess, you know, we take the encouraging news and we take hope in that, as we should. But, you know, when you're looking at the reality of variants, the more people who get infected, the more mutations will happen. And so we're going to have social distancing measures and face masks for a long time to stop that the virus spreading from person to person and mutating, correct?
That's correct. I mean, it's concerning seeing that some states are loosening their restrictions. They're letting go of their face mask mandate. They're letting go of the physical distancing. They're opening indoor restaurants. And with these variants circulating around, it's extremely concerning. These variants are highly transmissible, 70% transmissible, and they have the ability to mutate themselves. So I highly encourage, even though there are states that are opening up, still wear those masks, still physically distance, and take heedance.
Yeah, absolutely. Great advice. Dr. Ravina Kula in Los Angeles. Always good to see you. Thank you.
Thank you, Michael.
Now, Denmark is about to become the first country to roll out a coronavirus passport in the coming weeks. But as CNN's Nina Dos Santos explains, the project already coming under fire.
In Denmark, it's been a long winter, and many are feeling it's high time life got back to normal. So, could this be the answer? An electronic COVID-19 passport easing restrictions for those who've had their inoculations. The kingdom plans to have offered all of its 5.8 million citizens a jab by June. Before that, it could be one of the first places in the world to unveil a scheme for its vaccinated, perhaps as early as the end of this month. It's all part of a plan to open up business travel first, with a push from hospitality and entertainment to be part of the solution after that.
If we do not start prepare now, then when COVID-19 has left society, then it will be too late. So with this project, this close cooperation between the government and business organizations in Denmark, we're very positive that we will have a summer of joy, of football, of music.
COVID passports are not new. The idea has been around since the start of the pandemic, but finding a way to access data easily while storing it securely will be key to their take-up.
So I want to onboard my plane. I'm going to trigger my Corona pass.
Two strategies are in the running, one that uses the cloud and the other based on blockchain, like IBM's Digital Health Pass, which its developers in Copenhagen have already created and adapted to store information on new variants.
It's proven that I'm vaccinated and tested negative, so no corona. I'm good to go.
We've opened up the Corona Passport to store all relevant data to COVID-19. So it's the testing results, it can be the antigen results, it could be vaccines, and it can be any kind of vaccine related to the mutations that we're seeing from the virus.
That may sound simple enough, but some restaurateurs have reservations.
I don't know how it will work, because who have to see the passport all the time? It should not be the restaurant's job to check if they have the Corona passport. I don't think that all the shops and restaurants can handle to check Corona passport.
And what about health discrimination? Kalina Hansen has lodged a petition with Parliament to block the passport's rollout. Here's why.
I think it will split the population in a sort of a A and B class. It will make it hard for people who don't want the vaccine to navigate in the society.
It has to be done in a way that respects privacy and also the safety and security of data. We have a very digitalized society. The public sector is the most digitalized in the world. So therefore we can do that. We have the systems to safeguard also the security of individuals' information.
Denmark isn't the first country to consider this type of technology, especially in the EU, where freedom of movement is crucial to the bloc's ethos. Back in September, before vaccines were available, Hungary introduced what was dubbed an immunity passport. Now, Greece, Sweden and Poland are reportedly planning their own digital COVID documents. Whoever rolls theirs out first may give cover for others to soon follow suit. Nina Dos Santos, CNN, London.